Hello everyone, this is me again, Camila Pimentel. In this video, we will talk about Down syndrome, a chromosomal disorder, but digestible. So, let's begin. What is it? Down syndrome, or trisomy 21, is caused by the presence over, of all or a portion of a third chromosome 21, with an incidence of 1 in 700 live births in the United States. I highly recommend watching our video called Introduction to Chromosomal Abnormalities to understand how this happens better. It's the most common chromosomal abnormality due to the survival rate since chromosome 21 is the smallest and less dense of the autosomal chromosomes, so there's less genetic information added when you add a third chromosome or third genetic material, compared to other chromosomal disorders which spontaneously abort more frequently. In Down syndrome, only about 50 to 75% of fetuses are lost before term. So they curse with mild to intellectual disability. Also, they have growth retardation and have characteristic facial features, which are in the head. They have microcephaly, which is a small head, a flattened occiput, which is a flat back of the head. In the eyes, they have an upward angle at the lateral edge, or also called slanted eyes, and epicanthal folds, which are folds in the inner corner of the eye. And finally, they have brush-filled spots, which are most noticeable in light-colored eyes. They are small, white or grayish-brown spots on the iris, which is the color part of the eye, that form a ring around the pupil. They are caused by an aggregation of connective tissue and are a characteristic feature of Down syndrome. In the mouth, it's usually held open, the tongue protrudes and is furrowed. The tongue lacks a central fissure. The ears, they're usually small and rounded. And then hands and feet, they're short and broad hands with a single transverse palmar crease. Also, they have clinodactyly, which is a curved finger of the fifth finger. Feet may also have a wide gap between the first and second toes. Again, showing the main characteristics, here we have on image number 1, the head in frontal view, where we can see the slanted eyes, epicanthal folds, and protruding tongue. On image number 2, we have a lateral view of the head with a flattened occiput and small rounded ears. On image number 3, we have the eyes with brush-filled spots. On image number 4, we have the hand with a single transverse palmar crease. And finally, on image number 5, we have the foot with a wide gap between the first and second toes. Typical karyotype. An extra copy of chromosome 21 is associated with Down syndrome, which occurs due to the failure of chromosome 21 to separate during gametogenesis, resulting in an extra chromosome in all the body cells. So, the typical karyotype for Down syndrome is 47XY plus 21 or 47XX plus 21. However, the typical karyotype is not the only way to get Down syndrome. All is needed is duplicated material from chromosome 21. Here we have some examples that aren't the classical 3 chromosomes. So, we have the Robertsonian translocation, which can happen in one of the X's. In this case, two acrocentric chromosomes are sent where their chromosomes at the centromeres are close to the edge of the chromosome. They break at the centromere, losing both of their short P arms, and they create a new single chromosome containing one centromere and the Q long arms of both original chromosomes. This means that they have duplicated information of the long arms of the chromosome. Aside from Robertsonian translocations, we can have a ring chromosome that can result from a chromosome that undergoes two breaks and the broken ends fuse into a circular chromosome. We can have an isochromosome, which can form when an arm of the chromosome is missing and the remaining arm duplicates. It happens when the centromere divides horizontally versus vertically. Some more are insertions. An insertion is the addition of one or more nucleotides into a DNA sequence, or a larger segment of one chromosome being inserted into another. In this case, the long arm of chromosome 21 attaches to another chromosome, usually chromosome 14. Mosaicism, where postzygotic mitotic errors happen, and you have two different cell lines in one individual with varying degrees of compromise. Causes. In 95% of cases, the syndrome is caused by trisomy 21 that derives from a meiotic non-disjunction, and in 75% of these cases, the non-disjunction occurs during the oocyte formation. That's why it's important that to know that the risk of having a Down syndrome baby increases with maternal age. Um, Down syndrome critical region on 21q21.22 is responsible for many clinical features of Down syndrome, but there are multiple critical regions that are still being studied. Hematologic disorders. Hence, hematological abnormalities in newborns with Down syndrome, usually mild and resolves within the first 3 weeks of life. So let's look more into that. Hence, it's usually we have in 80% of cases we have neutrophilia, which is increased neutrophils. In 66% of cases we have thrombocytopenia, which is low platelets. In 34% of cases, we have polycythemia, which is an increase in red blood cells. We also have a transient myeloproliferative disorder, also called transient leukemia. The it has it's based on the detection of blast cells in younger than 3-month-old babies with Down syndrome. Clonal proliferation of megakaryocytes, which are the platelet precursors, and this happens in about 10% of patients with Down syndrome. Also, it's good to know that patients with Down syndromes are 10 times more at risk of developing leukemia. Cardiovascular system. The incidence of congenital heart defects in persons with Down syndrome is up to 50%. Let's explain how the heart normally works before I explain the pathologies. Look at my cursor. The deoxygenated blood gathers into the right atrium through the superior and inferior vena cavas, then it passes to the right ventricle. When I say right, I mean the blue side. Afterwards, it passes through the pulmonary arteries, which is this ones, to the lungs, where it becomes oxygenated. Later, it comes back to the heart through the pulmonary veins, which are in red here, which connect to the left atrium, and from the left atrium, it's good to know the left side is represented on red because the blood is more oxygenated. From the left atrium, it passes to the left ventricle, which tends to have thicker muscles. So you have a thicker muscle wall. From the left ventricle, the blood is pushed through the aorta, which is this rounded structure over here, to the rest of the body. So let's talk about the abnormalities. The congenital heart defects that are common in people with Down syndrome are atrioventricular septal defect, which is the most common defect. Look at my cursor again. In this case, both the ventricles and the atriums are gone, like the wall dividing them is gone. So the oxygenated blood mixes with the deoxygenated blood. This means that the systemic circulation is not getting the most oxygenated blood possible. This also means that the heart has to work harder pumping blood, and this increased pressure can cause pulmonary hypertension because the pulmonary artery is going to have a lot of pressure. Pulmonary hypertension, since the same pressure that's used to go to the rest of the body is used on the blood that goes to the lung. To make it simpler to understand, all four chambers of the heart are connected. So the four chambers are the two atriums and the two ventricles. Ventricular ventricular septal defect is the second most common of them all. Watch my pointer again. In this wall here, there is a hole, which is small, which if small, it can cause a left to right shunt. A shunt is a what blood passes from one side to the other and can be heard as a murmur on auscultation. If bigger, it can end up in congestive heart failure. Secundum atrial defect. This means that in this wall here, the atriums have a hole, and the oxygenated blood also goes back to the right side because there is also a shunt. Tetralogy of Fallot is a disorder that has four concomitant heart defects. We have ventricular septal defect here again, which causes a shunt, and overriding aorta, which is an aorta that's going to be about right above the defect on the ventricle wall. So the mixed blood is going to go through that aorta. A pulmonary stenosis here. Stenosis means that it's a rigid entry to the pulmonary artery, and this will has a right side ventricular hypertrophy. As I mentioned, the left side, the muscles are usually thicker because they have to push blood to the systemic circulation. However, the right side, the muscles are thinner. So if this here is rigid or has stenosis, then these muscles are going to compensate and become thicker and thicker. Neurologic disorders. Nearly all the patients with Down syndrome have mild to moderate learning disability. 5 to 10% of children with Down syndrome have seizures. 40% develop tonic-clonic or myoclonic seizures by their 30s. 84% past 45 develop seizures. So they have a reduced brain volume, especially in the hippocampus and cerebellum. Hypotonia is a hallmark of babies with Down syndrome and is present in almost all of them. It is defined as decreased resistance to passive muscle stretch and is responsible for delayed motor development in these patients. Lennox-Gastaut syndrome is also seen to be more prevalent in children with Down syndrome when it does occur, has a late onset, and is associated with reflex seizures along with an increased rate of electroencephalogram abnormalities. The risk of developing early onset Alzheimer's disease is significantly high in patients with Down syndrome, with 50 to 70% of patients developing dementia by the age of 60 years, which is known to be associated by 60 years. Amyloid precursor protein, or APP, which is known to be associated with increased risk for the Alzheimer's disease, is found to be encoded in the chromosome 21, and trisomy of this protein is likely to be responsible for increased frequency of dementia in people with Down syndrome. Recent studies have shown that triplication of APP is associated with increased risk of early onset Alzheimer's disease, even in the normal population. Trisomy of multiple genes, including DYRK1A, synaptogenic 1, and single-minded homolog 2, SIM2, have been found to cause learning and memory defects in mice, which suggests the possibility that the overexpression of these genes may likely be causing the learning disability in people with Down syndrome. Gastrointestinal. Patients with trisomy 21 have many structural and functional disorders related to their gastrointestinal tract. It has been found that many defects occur more commonly on people with Down syndrome versus the general population. One example is that celiac disease is present in 5% of these patients. Duodenal and small bowel atresia or stenosis is one of the diseases that they can have. Watch my cursor again. This part of the intestine is the duodenum, and this is the small intestine. It could be completely blocked or very tight. This can also happen aside from the duodenum, it can also happen in the small bowels. Annular pancreas. The pancreas is the structure behind the stomach, and part of it pulls around the duodenum in a ring form. Imperforate anus. When the anus doesn't have the external orifice. Hirschsprung disease. A birth defect where nerve cells are missing from parts of the intestine, preventing it from relaxing and pushing stool through, which causes a blockage. Gastroesophageal reflux. Here, look at my cursor again. This is the cardiac of the stomach. It's supposed to be closed when food is not being digested. However, if it lets stomach content through to the esophagus, it causes gastroesophageal reflux. You can also have chronic constipation and intermittent diarrhea. Endocrinological disorders. Thyroid gland dysfunction is most commonly associated with Down syndrome. Hypothyroidism can be congenital or acquired at any time during life. About half of the patients with Down syndrome have been shown to have subclinical hypothyroidism with elevated thyroid stimulating hormone and normal thyroxine levels. Thyroxine is the thyroid hormone. Um, so they can also have delayed puberty in girls. This manifests as primary hypogonadism, which is low sex hormones caused by the ovary, and a delay in menarche or adrenarche, which is the first menstruation, and also the appearance of sexual characteristics. In boys, however, we can have cryptorchidism, which is when the testes fail to descend to the scrotum, causing infertility, ambiguous genitalia, micropenis, small testes, low sperm count, sparse growth of axillary and pubic hair, and also the insulin-like growth factor is responsible for the delays in skeletal maturation and short stature in patients with Down syndrome. Musculoskeletal disorders. Children with Down syndrome are at an increased risk of reduced muscle mass because of hypotonia, increased ligamentous laxity, which causes retardation of gross motor skills and can result in joint dislocation. These patients also tend to have low vitamin D, which causes them to have low bone mineral density and recurrent fractures. Eye abnormalities. Brush-filled spots, which are small, white or grayish-brown spots on the iris of the eye, often arranged in a circular pattern. They are caused by accumulation of connective tissue and are more easily seen in people with light-colored eyes. In about 38 to 90% of cases, we can have iris abnormalities. That's the color part of the eye. We can have cataracts in 25 to 85% of the eyes, which is like a cloudy collection on top of the eye. Refractive errors in about 18 to 58% when the eye can't focus correctly, leading to blurred vision. Strabismus in 23 to 44%. These are eyes that aren't aligned properly on the same direction. And nystagmus 5 to 30%. This is an involuntary rapid movement of the eye. We also have amblyopia in 10 to 26%, which is a lazy eye. Blepharitis in 2 to 7% of cases of Down syndrome, um, which is inflammation of eyelid borders, and glaucoma in less than 1%. The glaucoma is heightened intraocular pressure. They can also have, in very few cases, optic nerve abnormalities. Otorhinolaryngological disorders. The anatomical structure of the ear in Down syndrome patients predispose them to hearing deficits. Hearing loss can be conductive, which could be caused by impaction of cerumen, chronic middle ear effusion, acute otitis media, eardrum perforation. Pressure equalization tubes are the treatment usually. It can also be sensorineural, and this is caused by structural abnormalities in the inner ear, such as a narrow internal auditory canals. Diagnostics. So we have ultrasound. In ultrasound between the weeks 12 and 24, we can see an increased nuchal fold thickness, small or no nasal bone, on large brain ventricles. We can also see nuchal translucency, which is not exclusive to Down syndrome. In maternal serum testing, in the late first trimester, we can see abnormal levels of plasma protein A. In the early second trimester, we have abnormal levels of alpha protein, alpha fetoprotein, beta HCG, unconjugated estriol, and inhibin. NIPS is a cell-free fetal DNA obtained from the maternal circulation, and it is tested for aneuploidy. Remember, aneuploidy is any number of chromosomes that's not the 23 pairs. This is now the screening option of choice for trisomy 21 in high resource settings. In confirmatory tests, we have chorionic villus sampling, which is a sample of the placenta, and amniocentesis, which is a sample of the amniotic, amniotic liquid for the karyotype, and confirmation can also be made by FISH and chromosomal microarray analysis. Treatment. Parental education is one of the foremost aspects regarding the management of Down syndrome, as parents need to be aware of the different possible conditions associated with it so that they can be diagnosed and treated appropriately. Treatment is basically symptomatic, and complete recovery is not possible. So you need to have an assessment for hearing, vision, congenital heart disease in the first 6 months of life. Therapy function should be monitored yearly. It's also good to have a balanced diet. Regular exercise and physical therapy are needed for optimum growth and physical gain. Remember, these patients have hypotonia, so they greatly benefit from regular exercise. Other specialties involve include a developmental pediatrician, pediatric pulmonologist, gastroenterologist, neurologist, neurosurgeon, orthopedic specialist, child psychiatrist, physical and occupational therapist, speech and language therapist, and audiologist. Prognosis: Down syndrome is a lifelong condition that causes with intellectual disability as well as a median life expectancy of about 60 years old in high-resource settings. There is an increased risk of Alzheimer's disease at an early age. Affected women have an approximately 50% chance of having a fetus that also has Down syndrome, and males are usually infertile. It's good to know that despite a diagnosis of Down syndrome, many people with this condition live happy and fruitful lives. So, I want to talk about this nonprofit, ADOCET. ADOCET is a nonprofit from the Dominican Republic. It's a multidisciplinary foundation that supports people with Down syndrome, including schooling for ages 2 to 20, extracurricular programs, speech and language therapy guidance, and support for families, awareness campaigns, academic support services, training, and job placement. You can contribute via PayPal or by depositing to their Banco Popular account. I'll leave the link in the description. So I want to give a shout out to the sources. We have, first of all, Langman's Medical Embryology. Then we have Down Syndrome by Faisal Akhtar et al. Also by MSD Manuals Down Syndrome, written by Nina Powell Hamilton. And I want to give credits to myself for the drawings, the editing, script, voiceover, to Jessie Bell for being the clarity editor, to Joanna Strange for being the humanitarian reviewer, to my family and dogs for the moral support, and finally you that's watching this video, thank you very much. And if it's not too much, please leave a like, a subscribe, and a comment, and see you on the next time.